What do they look like if you're looking there and it has spread?
I usually tell patients that it looks like somebody is taking little BBs or Rice Krispies and just kind of throwing them into their abdomen, and they just stick in different areas, and that usually looks like the spread cancer.
So to me, that would be very disheartening to look in and see a lot of BBs or a lot of Rice Krispies that were there, meaning that it had spread and was growing several different areas. If that occurs, what are our treatment options for this patient?
It depends on how extensive it does look. In certain situations, we will go ahead and proceed with a bigger surgery at that time, where we do a complete hysterectomy and take out the tubes and ovaries, and we try to take out all the cells that look like they have cancer on them.
How do you take them out? If somebody had a lot of BBs all over parts of the GI tract, how do you remove that? Do you pinch it off? Do you burn it? What do you do?
We can either sometimes cut it out at the time of surgery. We make a bigger incision and remove them that way, or we will use a laser sometimes or some other devices to kind of burn them in surgery.
So you've got a name for that, cutting down the number of tumors,
right,
removing them. What do you call that?
That's called a debulking surgery.
Debulking. So what you're doing is you're taking out as much as you can find. To me, that would take a long time.
It can. Sometimes it'll take you anywhere 3, 4, 5, 6 hours to do it.
Wow. That would be very tiring, very difficult, very pressure-filled, I would think, looking for all those spots. Is there a direct correlation with taking out more of those BBs versus leaving some behind?
You try to take out as much as you can to where you can either get rid of all of them, or you take it down to where they have less than about 1 centimeter of them left. So a small little area inside the abdomen.
So then when you come out, when you remove the surgical instruments, you've debulked as good as you can, then what do you do for the patient?
Usually we give chemotherapy at that point, once they've healed up from their surgery.
So chemotherapy is cancer medications to help kill the remaining tumor?
Correct. We're trying to get the areas that were so small that we couldn't remove them, but they're still there.
And so if you do chemotherapy, how hard is that on the patient? Is there a standard form?
There is a standard regimen that we use for ovarian cancer, and it's pretty much out of a cookbook almost. The majority of women in the country get a standard chemotherapy regimen with 2 drugs called carboplatin and Taxol that we usually give them about every 3 weeks apart once they finish with their surgery and they're healing from that.
So you give every 3 weeks, you give a treatment. How many of those 3 weeks do you start with?
Usually they get 6 rounds of chemotherapy, or it's called a cycle, so 6 cycles of chemotherapy.
During that period of time, how are you knowing, or what do you have that says this appears to be working or it doesn't appear to be working?
A lot of the time it's just the symptoms the patient's having. We really just monitor them now to see if they're feeling less bloated, less distended, to make sure that the fluid that they had, the ascites, before the surgery isn't recurring.
What's happening to the CA-125?
It usually goes down during the chemotherapy treatments. If it starts out really elevated, we can monitor it during their treatments and then see if it is coming down.
Do you get a routine CA-125, the blood test, routinely after chemotherapy to maybe wonder if it's coming back?
We used to all the time. Some of the newer studies that are out there don't show a lot of benefit in that. It just shows that it increases a patient's anxiety more than anything else because they're worried about their CA-125 number. But usually now a lot of people have gotten away from monitoring that. So I sometimes do, but oftentimes I don't.
Do you ever go in and debulk, take out as much of the little cancer as you can, then give chemotherapy, and then go back in and try and remove anything that's left over? Do you ever go back in a second time?
Usually if we're going to have to go back and take something out, we usually give chemotherapy up front to shrink things down instead of debulking them up front, and then we go back and take the cancer out in the middle of the chemotherapy. Sometimes you might go back and take stuff out later on, but it's not as common.